Throughout Europe and the rest of the world, one health issue is quickly becoming a major problem. Rheumatic and musculoskeletal disorders, or RMDs, are one of the leading causes of sickness, poor health and loss of earnings. By 2030, up to 50% of the population of some European member states will suffer from at least one RMD. But the problem is not just one that we will need to tackle tomorrow. Today, RMDs account for 60% of permanent working capacity within the EU, and over 100 million Europeans currently suffer from RMDs. 44 million are workers. This is a problem which cannot be ignored.
We have an issue in the European Union that a growing proportion of people of working age have rheumatic and musculoskeletal conditions, so conditions that affect their bones and their joints and their connective tissue. And that represents not just a social issue, but an economic issue, because if people with those conditions have to leave the labour market prematurely, that affects our ability to be competitive as an economy, but also to be socially inclusive. The European Union estimates that the total cost of rheumatic and musculoskeletal conditions across the whole of the EU is about 240 billion euros each year. That's about 2% of GDP. That's a really significant problem.
I think it's very important to tackle this problem now because we are, first of all, living longer. And so we have the real challenge that we're going to need people to be in work for a longer time. And remember, as we get older, we tend to get more rheumatic conditions. There is absolutely no reason to put it off. What are we putting it off for? We're only building up more problems in the future.
Because RMDs are not causing deaths, they are not considered, as the rest of the chronic diseases, as a very important issue in Europe. They are not like cancer, like diabetes or cardiovascular diseases, and they have been neglected. Most of the workers which are suffering RMDs, they are losing their opportunity and capacity to remain at work and also to support their families during the time of economic crisis.
Part of the problem is it's nobody's job to do anything about it. Everyone's looking at each other to decide who has the policy lead and who should be taking this priority. And the result is no one does anything.
In an effort to drive meaningful action and find a solution to the problem of RMDs, Fit for Work Europe has been working closely with policymakers, business leaders and healthcare professionals in more than 30 countries throughout Europe and the world. By changing the way RMDs are perceived, gathering more information on their prevalence, and by suggesting political and clinical solutions, Fit for Work Europe is seeking to make a real difference. One of the key visions of Fit for Work Europe is to see the early diagnosis and treatment of rheumatic and musculoskeletal disorders. Known as early intervention, this practice has strong clinical and economic benefits.
Early intervention has been shown to be effective for inflammatory arthritis, where you treat before chronic disability occurs. It's just recently been shown to be effective for all RMDs. And the consequence of this is that there is much less permanent sickness. In the UK, I found our payers, the commissioners, very receptive to the idea of this because it's a win-win. They save money and patients are healthier. It's a health gain.
Accelerating an intervention saves money down the line. And so as we're looking at saving money in healthcare systems across Europe and the rest of the world, early intervention for this group pays dividends, and it therefore needs to be given more priority. Early intervention is cost effective.
The major problem that policy leaders, businesses and healthcare professionals face is not one largely rooted in science or medicine. It is instead a problem of coordination and will. Only by working together with all stakeholders can meaningful action be taken.
We need actually to take good practices from those member states which are investing in prevention and prophylaxis, in early detection, and to exchange not just the practices, but to exchange mainly the political commitment tackling the core of this very neglected area, RMDs.
You have to be prepared to keep at it. This is in a way a movement, and you have to keep building that movement, because what you need is sustainability. You can't just go in there and think, well, now I've persuaded that government this is important. So I think all the time you need to be building momentum, but also building sustainability.
We need better joined up and coordinated action between all the stakeholders at national level and at EU level to make sure we can prioritise early intervention for people with rheumatic and musculoskeletal conditions, to make sure they get the support they need to stay in work, and if they have to leave the labour market, to return to work if that's what they want. And at the moment we're not intervening early enough because we don't have a mindset that tells us that prevention is important. The challenge for policymakers is not to come up with new solutions, it's to deploy and use the solutions we already have. And Fit for Work is pushing very hard for more joined up action to use solutions that we know work.
For more information on Fit for Work Europe and to find out more about their research and recommendations, please visit their website.